Welcome back again. This is video number 4, and as we've been talking about healing and the structure and function of the body, we talked about the function of the body through the spine and nervous system. Now we're going to talk a little bit more about that structure of the nervous system, as we alluded to last video, which is, again, your spine has to have a certain amount of motion or alignment. So from the side view, this is a normal alignment. We want curves. Your head is about 8 to 15 pounds. It's a bowling ball. It's stacked on these blocks, and these blocks are held together by ligaments. Imagine tight rubber bands. Those are holding the spine together. It's not the job of muscles, which I'll come back to. Muscles move the spine, but actually ligaments hold the spine. So if we lose this alignment through stress, trauma, accidents, injuries, where we lose that alignment, it's going to put more stress on the spine, more stress on the nervous system. Actually, it's been shown to stretch the spinal cord in this position, lengthens it up to about 1.5 inches. So what we're looking at here is this is a normal curve of a spine. The jaw's out in front. This is, again, near normal. It's moving back in the correct direction. Well, if we lose that curve, as we talked about, it's stretching the spinal cord. There's no damage or decay at this point, but what happens is over time, quickly though, within even a couple years, damage starts to occur. And that happens because the abnormal alignment, abnormal motion on those joints, that alignment is stressing these joints abnormally, and they're starting to break down. So we call it premature aging, although this is not an age-related process. It is a stress over time process. So if these joints don't move correctly and are not aligned correctly, they start to break down, they lose space. And what happens, there's less space for the nerves, less space for the joints. That can irritate the nerve even before you feel pain, just like tooth decay. So most people don't feel the decay process happening. They feel it when it's now a root canal and a crown process. So the decay was happening for a long time. That's a cavity. That's why you try to find that early. And if we wait till it hurts, it's now late, and that damage is usually permanent. So as this progresses, this gets worse over time. And again, this is not age-related, but it's time-related. But even in this person where we have damage, decay, arthritis down low, we actually have normal structure up above, and this is all just as old. So again, it's time versus age, and that's an abnormal process. That's why they call it a disease process. Okay, so next video we're going to talk a little bit more about the process of stopping this from getting worse. It's getting it stable and strengthened, and keep that from coming back on you. So I'll see you soon.